I wanted to warn you that the chemicals used on disinfectant and antiseptics can be very dangerous. So antiseptics and disinfectants are both utilized to kill or inhibit the growth of microorganisms. However, they have key differences and are used on different contexts. First off, I must mention that antiseptics are regulated by the FDA, which is the Food and Drug Administration in the United States. On the other hand, disinfectants are regulated by the EPA, which is the Environmental Protection Agency in the United States. So there are two ways to differentiate the two. First is their intended use. The second is their strength and concentration. So antiseptics are specifically designed for use on living tissues such as the skin or the mucous membrane. So they are widely employed in wound care and cleansing wounds and also during medical procedures. Uh, Whereas, or on the other hand, disinfectants are intended to be used on non-living objects and surfaces such as your table, your pen, medical equipments like your scalpel, your forceps, your scissors, and other non or inanimate objects. Okay, so they are widely used not only in the hospital settings but also in the home or in factories. Okay, so as far as their strength and concentration, antiseptics are typically less potent or less concentrated than disinfectants. This is because they are applied directly onto the skin or to the mucous membrane. If we have a higher concentration, it could be very irritating or could be harmful to our skin. On the other hand, disinfectants are often more potent and concentrated compared to antiseptics since they are used on non-living tissues. Okay, their formulation can be stronger to effectively kill a wide range of microorganisms. I must tell you, like what I said earlier, that the chemicals used for on disinfectants and antiseptics can be very dangerous. Okay, I will tell you. Example. Okay, a bleach, when it's mixed with an acid, it forms a chlorine gas, which is very toxic. If you mix a bleach and with a hydrogen peroxide, it can cause an explosion. That's dangerous, right? So, also, long term use of formaldehyde is linked to the formation or increased risk for cancer. Okay? And some disinfectants and antiseptics are flammable. So, as a general rule, ladies and gentlemen, we can use this product. However, you have to store these chemicals safely. Wear gloves and wash your hands after using disinfectants, and do not use disinfectants or antiseptics more than recommended. And never mix different products together. So now use disinfectant in a well ventilated area. Make sure you keep disinfectants and antiseptics away from your children, and do not overuse your hand sanitizer. Only use hand sanitizer when soap and water are not available. Okay? So now if you ever have any suspicion that you have been exposed to these chemicals, make sure that you go to the nearest urgent care or to the emergency department. Okay, things that you need to look at is shortness of breath, burning eyes, irritation of the throat or nose, runny nose, wheezing, cough, nausea, and even watery eyes. If you have these symptoms and you suspect that you have an overexposure to these chemicals from your disinfectants and to your from your antiseptics, but usually from the disinfectants, make sure that you seek medical help. I hope you learned something today and stay safe. Have a nice day. Now show me what you know. Tell me if the product is an antiseptic or disinfectant. Antiseptic. How about this? Disinfectant. In this? Neither. Once again, thank you very much. Please like, share, and subscribe. Once again, thank you very much. Please like, share, and subscribe.